Hello, everybody. How are you guys? So, like always, we're going to wait a couple minutes for everyone to go ahead and log in. We're going to try to give it a couple minutes. Thank you all for joining. Thank you all for joining. There's someone trying to join. Let's see, we got requests to join. Couple people. Request to join. Hello, everyone. Hello. I don't know. Okay. I'm just going to wait a little while to get a couple more people on here. We have bad connection. Can you guys see me? Cool. All right. Got our two presenters on board with us. Let's see if this is going to go through.
Oh, something's happening. Can you see it?
Yep, I hear you guys. I don't see you. Hi, yay!
Sorry, technical difficulties.
All good. Perfect. They were saying there was a little bit of a not good service, but I think we're all back on page. So I want to welcome you guys onto the Doggy Bakery Live. So today we're going to have Dr. Navarro and Dr. Thomas talking about in-home euthanasia, and they're going to kind of share their experiences, and they're going to be talking about what they do on a day-to-day through their company. So we're going to go ahead and just turn it over to you guys.
Okay, Thank you. So I'm Dr. Navarro. I'm a full-time ER veterinarian here in Texas, Dallas-Fort Worth area, and I'm also co-owner of All Pets Go to Heaven along with my colleague here.
Yeah, so I'm Dr. Thomas. I'm originally from the South Florida area, actually.
Yeah.
I'm also a full-time ER veterinarian.
Did something happen there? Or is it me? Can you guys see me? Hello. Trying to figure out if I lost you guys or what's going on here. No, what happened? Do you see me and not them? Let's try that again. Let me try to get them back on board. They disappeared. Yeah. Okay, you're back. I don't know what happened.
Sorry.
I'm not sure.
I'm not sure.
But together, Dr. Navarro and I, we are the team that we provide service to the Dallas area.
Perfect. Okay. So let's talk about kind of what is euthanasia. Can we start there for everyone who's watching?
Yeah, absolutely.
For sure. So euthanasia is the practice of ending a pet's life in order to relieve suffering due to terminal illness or incurable pain.
Yeah. Some of those examples could be chronic diseases like diabetes, which is one of a condition that's really hard to manage. Another one could be osteoarthritis that naturally comes with aging pets. You can try one pain medication that could give you a short temporary relief of pain, but you may need to alter the dosing or try a different secondary, tertiary pain medication to see if it kind of helps them out again. Or unfortunately, something like cancer, it's pretty common in our pets. Something along those lines of chronic diseases is definitely an indication of considering quality of life sometime in the near future.
Okay. Do you guys mind just sharing a little bit about the process of when you guys do these services?
Yeah, of course. So we want all the pets to be calm and comfortable. So we give them a little sedative when we come into the homes, and we give them about 15 to 20 minutes or so for them to kind of be calm and relaxed. We step out for 15 to 20 minutes, allow the medications to kind of take effect. That's the perfect time where families are kind of relaxing around their pet as well, talking to them, hugging, maybe taking pictures, sharing last meals, etc. After the 15-20 minutes is up, we come back in. set an IV catheter, and we give a first injection through the catheter, which is propofol. It's an injectable anesthetic. So usually they go into profound sleep. Sometimes they're snoring, which I think is kind of cute. And then the last injection is what stops their heart. So overall, those 2 last injections, it's probably 1 to 2 minutes or so before the PET does pass. We listen with our stethoscope to confirm. We let the family know, give them our condolences, and then kind of step out to kind of let the family mourn. And, you know, they'll give us a wave from outside, letting us know that they're ready for us to come in and collect their baby, and we'll transport them to the crematorium.
Yeah, and the important thing to keep in mind is that this 15 to 20 minute time frame that we give pets and owners is that when we give a sedative, it's a combination of sedatives and pain meds, but not every pet is going to be fully awake after that 15 to 20 minutes. Some pets are awake and they're still moving their head, they're wagging their tail, while other pets, depending on how sick they are, they will be totally unconscious. And so for, you know, this is a private moment for the family to be here. And so, you know, a lot of times this will be the last time some owners will be able to be with their pet while they are still conscious.
Wow. So, what would you say are some pros of having this service done at home?
For me personally, it's more so of the experience that the family taken, as far as like planning ahead of time, setting up the room, whether if it's in the living room or at a park. They take time, and there's a whole thought process there of what's the room going to be in, any soft playing music in the background, planned meals, inviting, you know, friends of friends, or even the children who are off at college, grandma, grandpa being present there. So I think it's really an intimate moment for everyone to kind of come together, and taking the time that you need. I think in a clinic setting, it's kind of difficult to do that. We're in ER medicine, so it's kind of hard to make it intimate, where it should be soft and calm, and again, very patient.
Yeah, and sometimes the setting can be other than an owner's home. We've had requests for us to meet owners with their pet in a park, and you know that can be a very unique and memorable experience, because I remember that event pretty well. It was with a kitty with a mother and her daughter, and it was just a beautiful day. You know, the sun was shining, the wind was blowing, and the birds were singing too. And here was this kitty, which was, at first we were a little nervous because we thought the cat was going to get disturbed and maybe decide to
anxious,
run or cower.
Yeah,
and actually, you know, this cat was just so at peace.
Yeah.
It was actually just a really peaceful moment, you know, and so we definitely know that was a very special moment to them. And you know, that was actually the time that we actually felt like, wow, you know, like we were making such a huge difference in people's lives. Yeah, it was very special, very special. Yeah. Other things that I can also think of too is, like, you know, as Dr. Devar was saying, you know, in a clinic experience, you know, sometimes those rooms are very small. You know, often they can be almost, some may even describe them as sterile. You know, there's nothing in there memorable, or there's no emotional attachment in that space for the owners and their, you know, and their pet. And so sometimes at home, you know, they can have very big family gatherings. You know, it can be just something for even the neighbors to come over, friends. You know, that community that's around that pet. It can just be, you know, just so much more than what can be offered in a clinic setting. Yeah, and
I've had clients too who are elderly, so it may be difficult with transporting, you know, their pet in their car. Second, their pet is really anxious, and, you know, car ride, getting to the clinic. Or cats can also be difficult, you know, finding them, putting them in a carrier. That's a whole process in itself too. So if we can just alleviate that, you know, absolve them from just having it all done at home, is such a peaceful experience for sure.
Yeah. And I am a big proponent of feeding pets at those moments before, all the brownies, greasy hamburger, a big T-bone steak. One of my favorites was when an owner brought out the dog bowl full of just scoops of chocolate ice cream, and the look on that dog's face, he just chowed down so hard. I don't know why, but even just something as small as that can, it's very touching, and even can bring tears to your eyes.
Pulls your heartstrings.
Very much so.
Oh, yeah.
So it, there's honestly, I don't think there's anything that beats it.
Do you guys have maybe a way that our clients can see hey, how to rate where my dog is with quality of life, or some sort of scale that can say let's start measuring where we are to kind of make a better decision on the quality of life of my pet?
Yeah. So we actually do have a quality of life tool that you can find on our website or social media, but it's designed to for clients at the benefit of their own home whenever they'd like to check in to see their quality of life of their pet. And it measures 6 things as far as how happy they are at home, if they're eating well and drinking well, if they're active still, if they're having breathing difficulties, eliminating well, and overall big picture as far as, do they have new diagnoses on top of old chronic diseases? And it looks at their quality of life as a whole. So it could be an easier way for them to help them make that hard decision, because it is a hard decision. It's a very, very hard one. So hopefully this tool can help them in combination with, again, talking to your primary veterinarian of hey, well, maybe we can help them move around better with, maybe some tractions on their feet, some joint supplements, some pain medication, maybe not some hard, long walks anymore. So we can try alternatives, but it could be a good opportunity for you to even contact your primary veterinarian and see what can you do from here.
Yeah, and just to kind of elaborate a little bit more on that, for instance, what does it mean by a happiness scale? And there are points on the website in regards to judging, where your pet is at on the happiness scale. It's kind of one of those things. It's as soon as you come home from work, is Ranger right there at the door, wagging his tail, jumping up and down, wanting to jump in and love on you and then go for a walk?
Right.
Or, is Ranger not there? Is he, in his bed, just lifting his head to see you as you walk in the door, then puts his head back down? When the family is around, is he also just still staying to himself? Things like if you go to pet him on his back end, is he snapping or growling because he's in discomfort? That's just one example of those 6 criteria that you have to go through and kind of make those judgment calls for.
Wow. Okay, so we can find these resources on your Instagram. I'll drop that handle once we post it live, so people can just swoop on in. Great tools that everyone can use just to kind of measure where you are if you're having this conversation or any confusion. I think these are some things that we can have just at reach.
Yeah, for sure.
So the other thing I wanted to ask you is there something, because not everyone really knows about this service. Is there something you wish that clients knew about this service?
So I would say that for the most part, we all wish that euthanasia is planned, right? But there are some situations where it could be on the day you least expect it. You're going off to work, you come back, something tragic has happened. So it can, come up all of a sudden. And when we actually do a euthanasia, it can be very, very quick. So in the span of 1 to 2 minutes before they do pass, after we give them the 2 injections.
Yeah, I'd say owners are always surprised. They're not all, but the majority of owners are surprised with how quickly and how how things can go from their pet being with them and not after the injections are given.
Yeah. Overall, again, the best in-home euthanasia experience is the planned one, because you can work up to it as far as making the experience on how you imagined it to be. And creating that soft, kind, gentle approach to your pet.
Absolutely.
Okay. What made you guys go into this line of work, if you don't mind me asking?
Yeah. So when I first graduated from vet school, I started at the ER, but then I quickly went into primary care, and I developed these strong relationship with clients. And so when it came down to euthanasias in the primary setting, it can be a little bit more calmer compared to ER medicine. So it's a little bit, I guess, softer feelings in going into euthanasia, because I felt like the euthanasia room was a little bit more prepared. But now being back in emergency, it's still, again, that fast pace where you can't really have the time, the free time to elaborate in a euthanasia. And I want to have those deep connections with the clients and be able to, again, have this serene moment with them. Kind of limited to offering, maybe we can just turn off one light in this exam room if that's okay, hold your pet, make sure they're on your lap, make sure talk to them as much as possible, but still kind of limited in an ER setting. So at that point, I wanted to reach out, and kind of bring that to the community as far as definitely an option here in this area in the DFW.
Yeah, the demand is really, really high. Owners do definitely want to be in control of the circumstances as much as they can around their pets' last moments. In GP and general practice and ER setting, owners they do request, do you know of anyone who can do this at home? And that's one of those things that we were like, man, there's a lot of people that really would appreciate this. And so, we decided, we can do our best to try and meet some need in the Dallas area.
We have a question. What are some subtle signs of pain or suffering that can be easily missed? Do you have any recommendations?
Yeah. I definitely say that, sometimes owners overlook the fact that their pets may just kind of be a little off that day. Sometimes they might not eat as much food that they typically would. Owners are like, but they're still walking around, or they're still being relatively active, just a little slowed down, but they're still eating in their eyes. They are still walking in their eye, but they may not be able to palpate the areas that are very typical for arthritis or injury in pets, as a veterinarian would, because we are trained to do an exam. We are trained to look out for these things, and sometimes just a palpation in the right spot can determine, hey, your baby's in some discomfort, just not overly painful.
Right. So what would you guys say? So I know go ahead.
I think other subtle signs that could be easily missed would be like muscle loss also. We see that a lot, or even like pets constantly licking a certain area that could indicate like joint pain as well. And then they start having like a skin lesion, and owners think, oh, it's like a wound issue, but it's really a joint issue. Yeah.
No, that's a great.
Yeah, and muscle loss.
That's a great one.
Yeah, and muscle loss can be one of those things that can be hard to determine too, because it can be very subtle sometimes. Or if your pet has a lot of hair, that can be very hard to determine.
Yeah, no, absolutely. I know we've touched a little bit on it, but what would you say are like things that people should know that it's like time to start considering euthanasia? So just kind of like, what would you tell the families to have like in the back of their mind, like things to start when to start considering in this choice that is not very easy for any of us to come to?
Right. Yeah. I would say chronic days of them not wanting to eat, or constant vomiting, still weight loss for sure. Especially if they share with me of like, I've taken them to the vet, I know that they have X disease, let's say kidney disease, eventually our dogs and cats start losing a lot of weight and they're still vomiting, and we say, let's give them some fluids, or let's give them some anti-nausea medication to kind of, alleviate the nausea. Maybe that'll make them start eating again. But they're still vomiting through that medication, and they're really not getting anywhere. I would say that's the main thing is you're trying to do things, but it's just not going anywhere. Yeah.
And sometimes it can definitely be very nuanced, where like each category that we've kind of described, there can be little parts of it that are all adding together to for a poor quality of life. we're not able to go for our walks anymore. We're not able to catch the ball anymore. You know, our appetite has been slowly getting less and less over the last few months. You know, there can definitely be some nuances that you know, that you definitely have to talk about and get a good history to really understand.
And I would say, just yourself, do you recognize your pet anymore?
Right. No, yeah, absolutely. Just, you know, some things that some of the people watching can have in the back of their mind for, you know, this unfortunate time that none of us want to happen. So after you're done with, you know, performing the services, is there final arrangements that you guys normally do, or how does that piece work?
Yeah. So it depends on what the family's wishes are. So after the in-home euthanasia, there is at-home burial. So the owners partake in the actual resting place. So they decide if it's going to be in their home, or in a pet cemetery that they have in mind, or we can do cremation. So communal cremation and private cremation are different. Communal cremation is when they're cremated, specifically with the crematorium we work with, they scatter the ashes across a pond nearby their crematorium. And then private cremation is being placed in an urn and then having them back home in a matter of 1 to 2 weeks or so.
Okay.
Yeah. And then paw prints as well.
Yeah, paw prints. Yeah, and then we, you know, there's the classic ceramic paw print. We also do ink paw print, but as well as nose prints. You know, that's something that owners are always, you know, it's, of course, it's in a sad setting, but there's a little bit of delight when they get to see their pet's nose print. You know, in ink. There's just an element of that's just so endearing. You know, everybody remembers their dog's nose.
Yeah.
You know, that's one of the first things that the dog puts into your face.
Yeah.
I know. Yeah, it's bittersweet. Yeah. And we, you know, do the ink prints with the family being present in their home, and they make comments of, we're gonna get this tattooed, you know, or hang it up and frame it. So endearing. Yeah. Yeah, super special.
Yeah.
In the time that you guys have been doing this, like what is some of the feedback that you guys get, you know, from like clients and people who recommend it? Sorry if my dog's in the background. Always, never fails.
It's always been positive. They're super appreciative, very, very grateful that this is a possibility for them to do at home.
Yeah, we try to be as personable as possible and supportive as possible. You know, because for us, it's you know, it's an honor to be allowed into someone's home, to be there for their pet's last moments. You know, we're complete strangers to them,
of course,
and we're there at such a, you know, emotional and intimate moment. So, you know, we're honestly just really there for them and the family, and try to do whatever we can to make it as special as we can.
Right.
Yeah, I love that. One of the people watching said, "I'm at work and I'm just crying. So much pain." No crying. We want you guys to know about the service.
Yeah.
Another question: do they feel any pain in the process? Good question.
It's a good question. So aside from giving them the sedation,
which is an injection.
Yeah, it's given in the muscle. It's usually in the back muscles because their muscles are very, very thick. So it's kind of like us, you know, kind of getting a vaccine. So they may feel a little poke, but after that, they start feeling very, very relaxed, very sleepy. The sedative that we give has some pain medication. So in that time span that we're giving them 15, 20 minutes to relax, they're feeling very, very good. After that, they are going to be very groggy. It ranges, like Dr. Thomas said, they can be very groggy, still kind of picking up the head, but very calm. And then they can go all the way up to completely being sleepy. The rest may not even be there to feel or even comprehend of what's going on.
Yeah, and it's all the whole process of doing it. So we try to make sure that we try to prevent as much pain as possible, and that's why we give a combination of sedatives and pain meds as well. But once after that injection, you know, they are feeling so good at that point.
Yeah.
Super. No, I do appreciate. That's a great question for people who don't know. I do have a client who kind of, she just lost her pet like about a week ago or so, and she did the in-home euthanasia. So she was very interested in us sharing her story. And so she's also told me that she's had her original, the original time she saw an in-home euthanasia wasn't a great experience, but when her dog Maggie had to pass, she had a great experience. And I think it really depends on the doctor, and if the connection that they have with the client, the dog. Sometimes it's, like you said, you're in ER. Sometimes it's last minute.
Mm-hmm.
For Maggie's case, her veterinarian took care of the dog for 13 years, and she suggested just doing it at home because Maggie didn't like going to the vet. So the dog started to just decline and decline. They had found like a mass behind the tongue. The mass got bigger. And then it just got to the point where if she was going to continue to suffer, or if, comes back to the same question of quality of life.
Yeah.
She couldn't really eat well. She wasn't herself anymore. And we knew Maggie, she's been part of like Doggy Bakery forever. And, when your dog's not the same anymore, the signs, once they're no longer subtle. So she had in-home euthanasia, and she said, the doctor was very empathetic and considerate to both the pet and the owner. And I think those are just crucial things that people should know about, knowing that, we can do this in the comfort of our home, especially if your dog is not comfortable going to a veterinarian. So it really depends about the energy, kind of like you guys said, sometimes a family sets up the home to make everyone feel comfortable. So rest in peace to Maggie and all the doggies out there and cats. But I just wanted to share that since, she saw her in this live. We have another question.
Our hearts definitely go out to Maggie and her owner, because we definitely have been through the same situation, our own pets in the past. So we definitely want people to know that we've been through the same.
Yeah, and I'm glad that her second experience went well too.
Absolutely. And I think that's what it's about. It's really all your experience, right? How you see it, and knowing that this can be positive is a great tool for people. Like everything you guys have said, like whether you can't get your dog to the owner, to the vet, whether they're not comfortable, whether you're not comfortable, having these resources are honestly the so the question is, how do you feel about behavioral euthanasia? Would you accept a request like this, or what are your thoughts?
Yeah, so that is a
tricky one. That is a tricky one, I will say.
There have been those cases that I've done before in general practice where the owners have tried everything. They've tried training. And this is not training through their own means. They've actually put up thousands of dollars to a professional trainer to try and mitigate and manage those aggressive behaviors.
Medications like doggy Xanax, for example.
And they've had cases where the dog is very loving to one of the parents, but in this case it was that for whatever reason the dog was dominant towards another owner, and that owner honestly ended up in the hospital 3 times. With the last time was the worst. She had to be hospitalized for a few days. There were very severe wounds that she also needed rehab for. It's sad, but in those situations where everybody has tried so hard to improve the situation, a pet like that is not going to be the best candidate for rehoming. Of course not. You're going to give this pet to someone else who's unsuspecting, who may not know the behavior of the history of this pet, and they could get hurt. They may go to the shelter as well, which, just from my experience of shelter med, those pets, they don't do well in shelters. And so it can be sad that, that pet has to be euthanized in this situation. But at the very least that I can say is that it is with a family that did still love that pet and cared for that pet and did everything that they could.
Yeah. Absolutely. And when we get those types of cases, it's judgment-free zone, because that is a hard decision for a family to have exhausted all measures, And here they are with, no other resource. And they have it in the best kind of, it's hard. It's a bitter, sweet decision. It's like the best way is just to let them go in peace before anyone else is hurt, or if they themselves are hurt as
right.
well.
Or they just, let them out to the street, and then you never know. Yeah, absolutely. You might as well. I'm with you on that one. Okay. It's definitely a hard decision. I can't imagine being in those shoes.
Yeah.
Absolutely.
All right. Do we have any more questions, guys? Any more questions we want to ask before we wrap up? Is there anything else you guys want to say to wrap up? Any final thoughts? Anything you guys feel like you missed on this service and how it can be beneficial to?
Yeah, I would say more of like a preventative measure too. So just as like a general, if you have pets over 7 to 8 years of age or older, they are already considered to be seniors. So I would highly, highly recommend taking them and having that constant relationship with your primary veterinarian to discuss anything, doing routine blood work, maybe even some x-rays. X-rays can miss some things that blood work cannot show, just to kind of be ahead of the game, Maybe they are going to be, come down to a chronic disease, but if we can manage it from an early standpoint, we may get, who knows, maybe another month, another good month out of them, maybe 3 months. So preventative care, definitely very, very important. Know who your pet is, know how old they are, know what's going on with them, be engaged.
Yeah, absolutely. We are 100% advocates for preventative medicine. At least a year, as Dr. Navarro was stating, just so that you can catch things before they get too bad.
Okay. Anybody else have questions? Any more last minute questions? Make sure we got everything. I love this. Thank you for joining us, everyone. Well, if there's no more questions, I know it takes a minute to type. If there's no more questions, I just want to say thank you for everyone who joined us tonight. And thank you both so much for your time and for everything you do every single day. I can't imagine, it's not the easiest, but I do really appreciate your time and everything you do. Thank you for all the information is in the comments. We will, hell yeah, 2 of the best vets in Texas. Thank you so much for arranging this. There we go. Here's all the love. Yes.
Thank you.
Absolutely. We'll be posting the live for anyone who did miss it. We'll also post their Instagram, so you guys can go on there for the pain scales and stuff. Any questions, post it on here. My girl shakes her front legs. Is that a sign of pain?
Good question.
You can go for it.
It depends on how old they are. I would suspect if they are an older gal, I would probably suspect could be, or sometimes it's anxiety driven. I would like to ask if there's any like stressors in the area, like, I don't know, loud banging construction sounds outside, thunderstorms. Is it behavioral or is it truly musculoskeletal pain?
Arthritis is definitely a big issue in the elbows. It can be. So it's one of those things you definitely have to get a good physical exam to know for sure.
Super. Yeah, it's a great question. But yeah, those are things to worry about, think about. She's 4, so yeah, she's still pretty young, but you never know. Like she said, it could be anxiety, anything of those sorts. But going to your vet would definitely get you some answers. But definitely a good thing to think about for the future. Got it. Thank you. Perfect. All right. So with that, I do want to thank you guys again for everything.
Of course.
I really appreciate
for
your
having
time. Say it again.
Thank you for having us. Sorry about the technical difficulties.
No worries. No worries. I do appreciate everything. And hopefully we'll see you guys soon again.
Yeah, absolutely. Yeah.
Thank you for having us.
Thank you, guys.
Absolutely. Take care, everybody. Have a great night.
Bye.
Bye-bye.
Bye.